I'm here with Dr. May Ismail. Thank you so much for joining me.
Hi, Chelsea. How are you?
So we're talking about colon cancer today. So I wanted to start off with asking you about why it is important that we screen for colon cancer.
So colon cancer is the third most common diagnosed cancer in the world. It is the second most diagnosed cancer in the United States. About 106,000 are diagnosed with colon cancer every year, and over 52,000 people die from it annually. It usually starts from either the colon or the rectum and often originates as a small clumps of non-cancerous cells. We call them polyp. Some of these polyps over time can progress into cancer. So the reason of screening is two things. We aim for detection and prevention. With prevention, we try and identify these polyps, remove them, and thereby preventing this disease from occurring. And with detection, we try and detect colon cancer at its early stages before it's metastasized. And when we do that, that gives us better chances for treatment and long-term survival. And so that's why colon cancer screening is a very crucial aspect of preventative health care.
And as far as prevention goes, when is the time to start screening for colon cancer?
So there have been multiple variations, and I guess the public's probably confused because we used to screen people at the age of 50, but now the recommendations have been at the age of 45. So the American Cancer Society and our society in gastroenterology recommends screening at the age of 45 now. Okay. We continue screening till about the age of 75, and beyond that, or extending screening beyond that should be a discussion between the patient and the physician, because we take into consideration multiple comorbidities, lifetime expectancy, and we also take into consideration what is your history with colon cancer screening in the past. There are people who are high risk for colon cancer, and those are mostly referred to as people with family history of colon cancer. The screening interval is completely different, and the patient should definitely consult with their physician about when to screen and how often they need to screen.
Well, currently, what are the available methods for colon cancer screening?
My favorite topic. So currently we have multiple ways to screen for colon cancer. All of them depends on patient preference, patient availability, pricing. So let me just start off with what we have available and kind of go from there. So we have the first one, I kind of like to divide them into blood, stool, imaging, and endoscopy. So these are kind of the four categories we have. The first one is the blood test. It's called methylated septin 9. It is available, and you can try, people at the age of 50 can start using it if they do not want any other modality for screening. However, the detection for it is about 60%. That's not very high. So, and we don't have really good data long-term for it. So I personally do not recommend it for my patients, but it is there and for people who want to use it. The second category, and that's kind of what I feel like a lot of people are familiar with it, is the stool-based test. We have the blood-based or the fecal occult blood testing, and we have the DNA testing, and I'll get into that in a second. So the fecal occult blood testing is basically we're trying to look for hidden blood in the stool sample. This can signify many GI conditions, including colon cancer. And these are divided into two. So the guaiac-based fecal occult blood test, this is as simple as placing stool sample on a guaiac-based test card, and then we treat it chemically. Once the color on the test card changes, that indicates there's blood. It means a positive test result. We have to send the patient for a colonoscopy after. This test is available, it's cheap. We do it a lot in the hospital. It gives you quick results. However, it is influenced by factors such as dietary factors. For example, if you eat red meat that day, your test is going to be positive. Other medications can influence that test. So I tend to be very wary of interpreting the results. But it is available, cheap, like I said, and
it's
easy
a good
access.
first step.
It's a good first step. The second option we have is stool-based test, which is commonly known as the FIT testing, fecal immunohistochemistry testing. This is a better, more superior to the fecal occult blood test that I just mentioned, because it actually uses the human globin, which is the protein that is found in red blood cells, using antibodies to detect that protein. So it is more specific, more sensitive, and again, readily available, a little bit more expensive, but it is easy to, submit the sample to. If a patient chooses that modality for screening, it needs to be done every year. The second option now commonly, which is called the multi-target DNA stool test, and commonly known, commercially known as Cologuard, uses two aspects. First aspect, we're looking at an assay of the DNA of mutated genes that we see in cancer. And the other aspect to it is the FIT testing, so also looks for blood. Very great test, high sensitivity, higher than the FIT test. If a patient uses that modality, then it can be done every 3 years. And again, if it's positive, we have to go to colonoscopy right away. And now coming to imaging, a lot of people don't know about that, but we have something we call CT colonography or virtual colonoscopy. This is using the same technique as this computed tomography, CT scan, generates image by looking at polyps, tumors, any abnormalities, give it to the radiologist reads it to us. If there's a polyp, again, you come back for a colonoscopy. There are several advantages and disadvantages to that test. I personally think it's great. It is less invasive. It is less procedure time. You do not need sedation. And it's great for the people who we cannot accomplish colonoscopy on because of altered anatomy, twisted colon, and that tends to happen. So that gives us an alternative to help these patients, screen for colon cancer. And the fourth one is a colonoscopy, which is basically a flexible tube, has a camera at the end of it. We insert it through the rectum to look at the inside of the entire colon, looking for any polyps or any abnormalities. And that's done by that camera at the end generates picture to a monitor, allowing the doctor looking for any abnormalities. Colonoscopy is the gold standard. Why is that? It's because it allows us to detect and treat at the same time. So it's the only test that allows us to treat at the same time. And if colonoscopy is chosen as the modality for screening and it's negative, then patient can do it every 10 years.
For more information on getting screened or tested, visit their website at greatlakescancercare.org.